Stay tuned for your weekly news review on STVS.
Good afternoon. My name is Randy Kromodiharjo and this is your weekly news in review. We start on Thursday, the 29th of May. The signing of the MOU by the KTPI to enter the upcoming election together with the new front, the BEP and Percaya Luhur, is just a preparation for the elections. So says Willy Sumita, chairman of the KTPI. The chairman of the Mega Combination was asked whether this step of the KTPI has consequences for the position of the party within the government. The presidents of the VHP, NPS, SPA, DA91, BEP, Percaya Luhur and KTPI have signed a letter of intent on Thursday the 29th of May. These parties are likely to enter the election of 2015 as one. The signing took place at the Marriott Hotel. It's a cooperation on constituency and district level. Equal opportunity for everyone, health, housing, employment, access to capital to stimulate entrepreneurship, eliminating the disadvantaged position of women and the youth are matters for which the combination wants to work for. The coordinator of the new front also reports that the collaboration is still open for other parties. Soon, multinational IM Gold will provide partly in its own energy. It will do this by means of a large solar project which will generate 5 megawatts electricity for the benefit of the production facilities of the company. The energy project also has an environmental friendly nature. The solar project of IM Gold was discussed 5 months ago with the government because Roosevelt wanted to cut in his cost. The company uses between 20 and 30 megawatts and therefore opted for a solar project of 5 megawatts. Ronald Hannas, VP Commercial, indicates that Roosevelt has invested between 12 and 14 million US dollars in the project. Mark Waldijk, General Director of Staatsolie and member of the board of Roosevelt Gold Mines, fully supports the large energy project. Minister Jim Hawk of National Resources welcomes the solar energy project because it gives substance to the green energy concept. The minister is convinced that renewable energy is the future of Suriname and the rest of the world. The Commission Gold Sector OGS, in consultation with the Ministry of Spatial Planning, Land and Forest Management, decided to give the mined areas of the Bronsberg to small-scale gold miners, the so-called park knockers. This decision was taken to provide the small-scale miners with a fixed workplace and to help bring calm in the area. Gerald Domper, manager of the OGS, said on Thursday the 29th of May that this decision should provide planning for the small-scale gold mining in the district of Brokopondo. He indicates that it's not a new area, but one that already have been mined for years by prospectors. It is in the upper left corner of the Bronsberg, which has already been affected by mining activities. The OGS manager says that the park knockers will work in the area under supervision. It is an area of 1,200 hectares. The Bronsberg Nature Park has since been expanded from 8,500 to 12,500 hectares. Some prospectors indicate that this decision will ultimately work well and that a piece of planning will come. Meanwhile, the Gold Sector Planning Commission has already been taken in order to ensure that no mining activities are taking place in the rest of the reservation. As of the 30th of May, the Bureau Alcohol Drugs will be called Clinic for Addiction Care. The clinic is a department of the Psychiatric Center Suriname, PCS, and it's open for the public. It took about 1.5 years to make the transition to addiction care. The name change was needed since the care and shelter of addicts became more professional and widely. Cynthia Burr, manager of Addiction Care, says that young people are the main target group. More than 100 young people who are addicted to drugs and alcohol are annually treated. Beur says that there is an increase in addiction among young people. Dayan Sankar Mathura, Managing Director of the PCS, who revealed the nameplate, says that care must be brought closer to the clients. The PCS is committed to further improve the mental health care in Suriname. The Ministry of Health calls on the community to be alert. It asks the community to take precaution to counter the chikungunya virus, CHIKV. The number of patients in the Caribbean has now risen to more than 1,000. Several Caribbean islands and neighboring French Guiana and recently Guyana have reported suspected and confirmed cases of CHIKV infection. Since December 2013, the chikungunya virus is spreading in our region. Due to the continuous movement of people between Suriname and the Caribbean area, French Guiana and Guyana, it is inevitable that the virus has found its way to Suriname. To prevent an outbreak of the disease in the country or to limit it, it's important to detect patients with the disease at an early stage. The chikungunya virus has dengue-like symptoms such as fever and pain in the joints. The treatment is, as in the case of dengue, aimed at relieving the symptoms until the disease is overcome by the inherent resistance. Important breeding grounds for these mosquitoes are water-filled barrels, buckets, flower pots and vases, gutters with drainage wells, septic tanks which are not properly closed, the waste water with old tires, cans, cups and serving trays in it. The Ministry of Health calls on the population to clean up the mosquito breeding grounds and protect themselves against mosquitoes. The ministry is also working on measures regarding the import of the disease by travelers and combat mosquitoes in public places and homes. Furthermore, the ministry asks to avoid mosquito bites and if the symptoms are detected to immediately alert the doctor. Increasingly, indigenous women are given the opportunity to lead their village. So says Minister Stanley Batterson on Sunday, the 1st of June, at the swearing-in of Margriet Biswane as Chief of Alfonsdorp in the district of Marowijne. Biswane is nominated in a traditional manner and was officially appointed Chief of Alfonsdorp, an indigenous village about 15 kilometers from Albina. The village has more than 350 residents. In order to do the work in the village smoothly, a new village council is appointed too. Along with the chief and the community, they want to make a new village plan. Minister Bertsen has made important deals with the new village administration. According to the minister, it is important that Alfonsdorp gets a push so that they can continue to work on the development of the village. The most important, according to the minister, is agriculture. The new council is aware that the area has a lot of catching up to do and that the focus points should be addressed soon. Electricity, water and education are things that definitely need priority. Only in the interior, chiefs and so-called bashas are appointed. Their task is to ensure order and bring development in their area. Several speakers talk about preserving the traditions of the interior which may affect the development. Currently, they are working on the water supply and electricity from Albina to the village. Only 5% of Surinamese women is in a decision-making position. This percentage should be up at least to 30%. That's if the initiator of the national campaign, Zij Ook or They Too, Karin Revos, gets her way. According to her, society should be made conscious about the matter. The first debate on women's leadership in 2015 will be held in July. Revos indicates that women should also stand behind this project and need to support each other. The adjustments of tariffs for hospitalization will enable hospitals to operate independently. So says Manoj Hinduri, President of the National Hospital Council, NZR. As of January the 1st, 2014, the government stopped the subsidies for the hospitals. After this, it was decided to increase the tariffs for hospitalization for state health insurance holders and people with limited means. Now, hospitals no longer receive subsidies, but get their fund from the tariffs of hospitalization. Hinduri says that hospitals are no commercial institutions, but that they should be seen as a company. With this increase, the hospitals can meet their own cost. There is no question that a possible increase for private insurers will come. According to Hinduri, their rates are currently competitive. The construction of the hospital in Wageningen is running smoothly. First Lady Ingrid Bouterse-Waldring got a guided tour. With the expansion and renovation, a complete hospital in Wageningen is established. Director Anton Elias indicates that patients recover better when they are nursed in their own environment. The construction of the new hospital, which is financed from own resources, was initiated in August last year. Preparing prisoners to return into society is a step closer. The Ministry of Justice and Police wants to change detention centers into correction centers. Those who are willing to change their behavior will get help from the Ministry of Justice and Police. For 3 days, representatives of the various youth organizations and NGOs, together with representatives of the ministry, exchanged views on the correction centers. Minister Edward Belfort performed the opening of the workshop. Paul Pinas, Acting Director of Delinquents Care, is pleased that the project is fully developed. The importance of this is that detainees are not looked at with disgust. For this group, it is often difficult to get a job after detention. To counter this, Minister Belfort initiated to engage in correction centers. The intention is that the prisoners are adjusted, Minister Belfort said further. The proposal that emerged from the workshop were presented to the Minister. This was our last item for this weekly news in review. My name is Randy Kromediharjo, and thank you for watching.
Stay tuned for your weekly news review on STVS.